Hi, my name is Dr. Matt Winter and I am a urological surgeon. I'm pleased to welcome you to this video discussing cystoscopy. A cystoscopy is recommended in the following situations: when there's blood in the urine that you can either see or detect at the lab, positive cytology, which is cancer cells in the urine, bladder lesions or masses that are found on imaging, when bladder stones are present, or when you have lower urinary tract symptoms or LUTs that cannot be attributed to a specific cause. What is a cystoscopy? A cystoscopy is performed by placing a camera into the bladder via the urethra. Unless otherwise informed, your cystoscopy will be performed under general anesthesia. Your legs will be in stirrups to allow access to your urethra and bladder. A cystoscope is a telescope with a long tube that has a light and a camera at the end. It has a working channel that allows instruments to be passed into and out of the bladder. I will insert the scope through the urethra and into the bladder. In some cases, the urethra may need to be gently stretched to allow the scope to pass easily. The purpose of a cystoscopy is to do one or more of the following: examine the bladder, to take photographs. Once the scope is in, the following may occur: we can inject medications, take small samples of tissue or fluid for washing or testing, to perform an X-ray picture or an RGP, a retrograde parallelogram of the ureters to ensure no blockage from stone, tumour or other pathology. We can remove bladder tumours using electrical current, which is called a TURBT or transurethral resection of bladder tumour. A bladder tumour is removed using a resectoscope, which is similar to a cystoscope but just slightly larger. If there is a small stone or a foreign body, we can also remove that. A laser may also be used to break up the stone. If needed and the ureters are blocked, a stent will be placed. A stent is a small hollow tube that is passed into the ureter from the bladder through the cystoscope. It is used to prevent or treat blockage of urine flow. When the exam and any treatments are complete, the scope will be removed and you may be left with a temporary catheter, which is usually removed within the next couple of hours to days. Preparation for surgery. Medications to avoid prior to surgery include blood-thinning medications such as aspirin, warfarin, Plavix or Pradaxa, etc. These can cause bleeding and should be avoided prior to surgery. I will advise you what medications you need to cease prior to the operation. If you are unsure, please touch base. Diet restrictions. Do not eat or drink anything after midnight on the day of your surgery. Immediately after the surgery, you'll be taken to the recovery room, and once you are fully awake and your vital signs are stable, you'll be given something to drink. Generally, you should expect to go home the same day, within 2 to 4 hours after the cystoscopy. If you have had a TURBT, which is a resection of bladder tumour, you may need to be admitted overnight for observation and irrigation of your bladder to ensure minimal bleeding. You can resume your normal diet after the operation. You may experience some discomfort and may require some pain medication for up to a week after discharge. Medication will be given to you if you need, but you can take over-the-counter medications such as Panadol and Nurofen to help with pain control. You may experience some nausea related to the anesthesia, pain medication or stent. Fatigue is common and should generally subside within a few weeks. You may shower after returning home from hospital. Walking is advised. Prolonged sitting or lying in bed should be avoided. Climbing stairs is encouraged, but you should take it easy. Driving should be avoided for at least 24 hours after the surgery, and please avoid any heavy lifting. You can generally expect to return to work within 24 to 48 hours after surgery. You will need to call the office after your surgery to schedule a follow-up appointment. As with any surgical procedure, there are risks involved. The general risks of surgery include anesthesia-related issues your anaesthetist will discuss in greater detail. Bleeding during the operation requiring a blood transfusion is rare. Blood clots in the legs, deep vein thromboses, lungs, pulmonary emboli or brain, stroke. Heart or lung problems, for example, abnormal heart rate or rhythm, chest infection, collapsed lung may occur. Adverse or allergic reactions to medication, damage to nearby structures, pain and scarring, and infection. The specific risks of cystoscopy include bleeding, this can occur early or late, infection, catheter-related issues or catheter being dislodged, irritative voiding symptoms, blood in the urine. You may be unable to urinate when the catheter is removed. If this is the case, you may require another catheter in order to go home. We'll get you back in a week for another trial to remove the catheter. Stricture of the urethra can occur, although rare. Urinary stents can cause symptoms such as blood in the urine, urgency to urinate, back pain and bladder cramps. These symptoms are very common and can be quite bothersome, but are not dangerous. Regular Panadol and Nurofen generally alleviate stent-related symptoms. Also, please ensure you drink greater than 1.2 litres of fluid per day. Inability to urinate. You may need a urinary catheter to empty the bladder. This will only be a short-term solution. Urinary tract problems can occur after the procedure. This includes difficulty holding urine, frequent urination, bleeding, and pain. These generally subside and get better in the next coming weeks. Damage to the urethra, bladder, or nearby organs can occur, although rare. Patients who undergo a TURBT are at risk of bladder perforation, which is 1 to 2%. The risk depends on the size and the location of the bladder tumour. Most perforations heal spontaneously within 7 to 10 days, providing a catheter is in the bladder. In rare situations, the bladder needs to be repaired at the time with either an open or laparoscopic procedure. Damage to the kidneys, kidney collecting system, ureters, or nearby structures can occur, although this is rare. You must notify my office or attend the nearest emergency department if you have bleeding in the urine that is getting heavier, not lighter, you develop a fever, or you have problems passing urine or worsening pain. I hope you found this video informative, and I trust it has better equipped you and your family to prepare for your upcoming operation. I am available to answer any questions you may have, or you can contact my office if you have any concerns. I look forward to helping you resolve your urological problems, performing the operation, and caring for you during the recovery.